Hi, guys. Good morning. Monday. Happy Monday. There we go. All right. Good morning, guys. Hope you had a great weekend. Back on Monday morning. Hello. Gonna give you guys a moment, okay, to join in. Good morning. Anyone over there on Facebook? Send me a holler. Morning, everyone. So Monday morning, it's almost the end of August. I can't believe it. Crazy. Good morning. Thank you guys for letting me know you're out there. Thank you. It was a nice weekend here in Arizona. We had some little bit cooler weather. I think it was only like 107. Crazy when 107 is cool. Hello. So I am Dr. Trisha Pingel. This is your morning checkup. It is Monday, August 24th, and we're going to be talking about something that's very near and dear to my heart today. Something that I truly 100% believe in and that research backs up. And hopefully it will help you guys find that right fit for you as a physician so that all of you can take better control of your health and become healthier and stronger and avoid more disease processes. Why am I here Monday through Friday talking to you guys? It's because I want to inspire you to take control of your health and improve your health. And this ultimately comes down to the patient. So sometimes doctors can get in the way of that, right? So I want to talk a little bit today about the doctor-patient relationship and kind of the philosophies that I found to be successful and some questions for you to think about when you evaluate if your doctor is the right doctor for you, right? There's a lot of options out there. And sometimes we get stuck with the doctor and we're not getting the progression that we want with our health. So I want to talk to you guys a little bit more about what works, what I found that works, what doesn't, and how to inspire you to be well. A little bit different topic. It's hot, but it's a dry heat. Yeah, but it is. I take the dry heat. I'll give you that. I don't want that humidity that a lot of you other guys are dealing with out there. I definitely appreciate Arizona's dryness for sure. Thank you very much. It says I'm very inspiring. I appreciate it. Well, I hope this inspires you as well. You know, it kind of goes into the way that I practice medicine in a sense in order to benefit you. And, you know, there's many different ways to approach medicine. There's many different ways to approach patient care. Not every doctor is the same and not every patient is the same. And what you need may be different than what your friend needs. So you have to find the right person to balance out that care. And so I want to give you some suggestions and some things to think about, right? So I am looking for questions. I will let you guys know my contacts gave me a hard time today. I have my glasses here. Hopefully I won't have to use them because I'm trying to read. Okay, so we're going to talk about the doctor-patient relationship and the importance of it, talk about some studies regards to that, okay, on this Monday. For those of you just joining in, I'm Dr. Trisha Pingel. This is your morning checkup, and here we go. So if you think about the last time you saw a doctor for the first time, you were likely pretty nervous, right? I know I am. Whenever I have to go to the doctor, I'm very nervous, whether I know them or not. You know, you could be nervous, you could be anxious, you're not sure what to expect. You know, you don't know what the bedside manner is going to be. You don't know what they're going to suggest. It's a very scary place to be, right? Especially when you're a new patient looking for a new doctor. You know, a doctor has many roles. I'll try my glasses in a bit. A doctor has many roles. And in my opinion, the biggest, most important role that a doctor has is as a teacher. Doctor as teacher. It's not a doctor's job to be smarter than you or order you on what to do or be a know-it-all. We don't need that. We have enough of that in our lives. What we need as a doctor needs to listen, educate, motivate, and help guide you in the right health decisions for you in that moment. The same solution is not the same for everybody, right? Not everyone has the same situation, so we can't all have exactly the same treatment, right? So I believe that the doctor's role is to be there as a resource, as somebody that understands the body and helps you understand your body and your options so that you can make the best choice possible for you and then support your decision, right? and be there as a cheerleader and someone who follows up with you. And that's a very important thing. You have the power to choose your own physician. So that's why I want to talk to you about this. Okay. Because I get a lot of people saying, well, my doctor won't let me do that, or my doctor won't let me do that, or my doctor says that I can't take vitamin C because they don't understand it. Well, then, there needs to be a conversation, right? We need to have a conversation. There's lots of doctors that can work together on a team as well. So that's another important thing. So I do have a personal story on this and how this kind of came to be and how I started to recognize how important this relationship was. Is when I was in medical school, we had to take our board exams, and we also had to do office visits, clinical rotations, and you had to see so many patients, and then you had to be basically graded on what you did with that patient, whether or not you were ready to go out in the world as a doctor or not. And these exams, basically, they would bring in a mock patient, they would give the patient a condition, and it was up to me to figure out what the condition was and to treat it, right? So that was kind of the test. Now, I really enjoyed this because I got to meet different people. And I remember I spent a considerable amount of time with this one patient that I remember. Very good connection. And I was opening and sharing experiences, and we were going back and forth. And in the end, the patient rated my job as a doctor, and the proctor rated my job as a doctor. And the patient said 100% connected with that doctor. I want to see her as a doctor, which was great. And it was inspiring to me because I was a med student, right? And I really enjoyed the office visit. It was great. The proctor said, you know what? Your patient loved you, so you're going to get a good grade. But I think you got too personal. You need to wear your white coat, sit behind your desk, and put up that authoritarian wall. They wanted me to show my authority over this patient. And although I appreciated his opinion, right, because this was a mentor, I really felt differently. I kept coming back to the same thing, which is, how do I encourage you to take control of your health if you can't understand that I understand your frustrations, right? If you just come in and say, hey, doc, I'm experiencing pain. And I'm like, oh, okay, well, let me get out my script pad for pain. We write this, this, and this. Here you go. Versus, tell me about the pain. When did it happen? Oh, I remember. I had another client who had something similar to that. This was something they tried. Have you tried that? Have we, do you have, you could go into 1,000 different things, but you have to have a communication with the patient in order for the patient to trust you. So I couldn't understand how that could be done in an authoritarian type manner. If I'm sitting behind a desk and I'm wearing a white coat and you're sitting there petrified, right? Because I'm a new physician, you don't know who I am. Right? You're scared. Think back to what we just talked about. The first time you saw a new doc, you're not sure what they're all about. You don't know if you want to divulge your whole health history, right? It's very important to establish that connection. Okay, and that's actually been proven in research. So even though I disagreed with this proctor, I understood where they were coming from, because that was the traditional model, right? And that's the traditional model that we see quite commonly. Okay, but how can a doctor encourage you to get well, right? If we don't connect. In the end, do you know who makes themselves well? You. You, right there, not me. My job is to educate you on how to make yourself well. Your job is to do it, right? And to make that commitment to yourself and understand why you're doing it. So in the end, it's you, the patient, that has to learn from the office visit and make the appropriate changes to be well. The power lies in your hands, not mine. So I think often we get kind of this egotistical complex. I think there's a lot of doctors out there that think, well, it's me. I'm the doctor. I'm the one that says what to do. It's really not. I mean, yes, we're educating on, okay, you have an option of this, this, and this. I've seen this work. Here's my information. Here's how your body works. Here's how the medication or the supplement or the lifestyle change impacts your health, but ultimately it's you, right? Now, this has been proven in research. Okay, they've done a lot of research on this. There was a 2017 study that showed that building trust and rapport early in a new doctor-patient relationship is absolutely vital in improving the patient's overall health. okay? So your health depends quite a bit on how you interact with your doctor, right? If you go into an office visit and you have 5 minutes and they're like, boom, what are your symptoms? Boom, 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 here you go, quick exam and out the door. You don't have a time to be like, well, do I trust this person? You know, I don't know anything about them. Do they even have any life experience similar to me, right? Sometimes that matters, right? Now, I will say, even though I like to have that rapport with my patients, I've had some patients over the years that are like, look, doc, I don't want to know. Just tell me what to do and I'm out the door. And that's fine. And I can do that because I'm understanding and learning them if that's what they need, right? So it's my job to figure out what's going to motivate the patient. So if me explaining it puts them to sleep and they don't care, there's no point in me explaining it. But I do find those are not the most successful patients with therapy. The most successful patients that I have, the ones that I have watched amazing, miraculous recoveries in, are those that ask a lot of questions and have a rapport, that understand that I understand what they're going through, or that I know someone with similar experience, or that I've gone through similar experience, or that I'm thinking about what they need specifically. Thank you. I have someone who saw my colleague recently, Dr. Gages, who shares a roof with me in my office, and she is wonderful. She's so sweet and so kind. And we have been together. We went to med school together. We carpooled together every day. She's wonderful. And this patient is saying best time spent with the doctor. She talked to me as if I'm talking to a friend. She spent a good amount of time and explained everything so clearly. I absolutely have to agree with you. And that is why I refer to her. My patient database is rather small. I do a lot of this type of thing and I do concierge medicine only. So she is my go-to person and she's amazing. So thank you. I'm happy for the feedback. And it's true. You have to find someone who truly cares and can relate to you. You will become the best person you can be if you can talk to your doctor and you can understand that they're understanding you. And research supports that. They found in this study actually that if the patient does not build trust and rapport with the doctor, that they have a higher risk of missing subsequent visits. You're not going to go back if you don't trust them or if you're not sure. There has to be something in that first office visit that makes you say, you know what? I don't know if I know yet, but I like the relationship. I can tell that they're thinking about me or that they understand what I'm going through, and maybe this is just going to take some time to get through. Unfortunately, with naturopathic medicine, it's really quick. So a lot of people don't have the longevity. They just don't want to stick through naturopathic medicine as long. They want that quick fix, and sometimes I just can't help with that, right? But there needs to be an understanding that there is a process. There is a long process, a long road. And if you have someone on your side that's there educating you along the way, you will absolutely get there. Okay? So they found, though, that also the researchers found that educating patients while remaining understanding and non-judgmental not only calmed the patient's anxiety and vulnerability, but gave them a better quality healthcare experience. Okay, it encouraged their attendance for future appointments and motivated them to adhere to their treatment plans. So I want to ask you, what keeps you from going back to the doctor? What makes you walk away and go, I wasn't listened to, right? So I think as physicians, we need to do our part. We need to make you feel comfortable. We need to make you feel welcome. That it's a pleasure to work with you, right? Because it is. It's an absolute pleasure to watch somebody go from an unhealthy state to a healthy state. It is probably one of the most rewarding things I've ever seen, in addition to being a parent and watching my kids grow up. I mean, there's a certain love that I have for watching patients improve and watching them do it almost by themselves, just with encouragement and understanding. So very, very important. There was another study in 2018 that reviewed over 17 articles that revealed that trust and communication were the two doctor-patient relationship qualities that were positively related to patient satisfaction and overall quality of healthcare. The authors of this review noted that these qualities were linked to better compliance. Oh, lost Instagram. Hang on, guys. There we go. I don't know what's going on with Instagram today. All right. So anyway, they found that having a good doctor-patient relationship improved in compliance, you know? So, and that's important because you have to be well. So you need to comply, right? If I don't explain something to you, if a doctor isn't explaining something to you, how are you going to be likely to comply to it? You know, especially when it comes to medications with side effects. Sometimes you have to use them, okay? But you need to understand them, right? If you understand them and you understand the long-term goal of it, if I was like, hey, I think you should use this right now while we build your adrenal function, while we balance out your thyroid, while we do these types of things, and then in a year, this is where we're going to be, and this is what I'm planning to do. We need to keep in contact in the meantime. It gives you a plan that makes it easier for you to understand. You know, patients are very knowledgeable in medicine. I have someone saying that doctors won't listen to the patients. I find my patients teach me more than anything else. In fact, many times in the Q&As, you guys will ask a question where I'm like, wow, I don't know that one. I gotta go look it up, right? And that's great. I love it, right? Because it expands my knowledge. There are so many different ways to treat different conditions, and there are so many different specialties of medicine. So to learn them all and keep them all in a brain as a doctor is difficult. So I think what happens is many doctors use that as a learning opportunity and a growth opportunity to learn from their patients, and others choose to just shut it down. You know, or just say, well, I don't know it, so therefore you can't do it, you know, which isn't really fair. I find that there is, patients know so much more. It's unfortunate in some respects. Dr. Google is not always the best way to go, but just going and opening up the door of conversation, if that opens up a door of conversation with the physician and the physician is willing to have that banter with you, that's a great physician, okay? Lack of compassion makes me less interested in a return visit. I agree with you, Donnie, I really do. In fact, this kind of goes into the 5 things that I'm going to go into about what to look for in a physician, but I'll tell you another personal story. I had a medical situation about a year ago, and it required me to have to go to the doctor, which I really don't like to do too much. I have good friends that are physicians, so I typically choose to see them. But in this particular situation, I needed to speak to somebody, and it was a new patient appointment. It was probably only scheduled for 30 minutes. Granted, I'm a very educated person, so I went in there with a lot of questions, okay? I had a list. I knew exactly what I wanted to find out, and I recommend this doctor to many people. It was not a naturopath, this was a conventional doctor, and one of the reasons I recommend her to people is my experience with her. Not only did she take the time to answer those questions, but when I was anxious about it and I needed calming down and she could tell that I hadn't had all my questions answered and I really wasn't feeling comfortable yet, she actually offered to move me into her office, and she said, if you're a patient, you know, if you can let me see a couple of these quick visits, I'll come back in and talk to you again in about 20 minutes. I don't want you to leave without feeling comfortable. And at that moment, she was my doctor. And number 2, I now refer her to other people. There was something about that. She did not want me to leave, not understanding. So it's always very important. Even if the office visit is quick, you can always request a follow-up appointment by phone. You can request more information. You can tell them, look, I am not comfortable with this. I really need more time. Maybe you make another appointment next week, you know, a longer appointment. Maybe they put aside. If your doctor's willing to work with you on that, that's a good sign. Okay, sometimes they are overloaded. Sometimes emergencies do happen. Sometimes they don't have the time that day. Totally understandable, but are they willing to take that time, you know, with notice, right? So if you're going to talk about something, you're making an appointment with somebody, you may request more time. Say, look, I'm going to need a long appointment today. I have a lot of questions. I just want to give you a heads up. And maybe they can book it that way, right? So those are some things to think about. I have some questions. Hang on, guys. They compare their stories with the patient. I don't want to be compared to them. I'm not sure what you mean, Tricia. You mean like comparing patients and patients exactly the same? Or relating to their own somewhat experience? Kind of curious. How do my doctor and I work past frequent frustrations that build up because we can't figure out what's wrong with me? Because since I've gotten COVID back in April, my health has been bad and with symptoms and no one knows what they are. You know, COVID's a tough one because it's so new in treatment that a lot of people aren't really sure what to do. They're afraid to do stuff. I think, I don't know what to say past frustrations. If you and the doctor just aren't meshing, maybe need to, you know, look if you can have a second opinion on it, perhaps. That's a tough one. Trisha, their own experience. Okay, yeah, because like for me, I do talk about a lot of my own experience, but a lot of my experience with the varying degree of patients, right? So many people try different things. So I think it depends on the doctor's experience. If it's an authoritarian experience, like, well, I've seen that this medication works and that's the only option, is the way we're going to do it, versus, hey, I've seen some patients that don't respond well to this, and I've seen others that have. Here's what happened in the ones that did. Here's what happens in the ones that didn't. Here's what it does to your body. Let's look at your body. Do you fit into any of these categories? So there's a different way to make it about own experience without making it authoritarian, if that makes sense. Yeah, I understand, Trisha. I do. I get it. Okay, so I'm glad you guys are interested in this. I wasn't sure about this topic. This is all about you guys, right? This is about you. How do you get well? You get well by having a relationship and assessing whether the relationship you have is helping you or not. If you're not growing with your doctor, this may go back to Rick. If you're not growing with your doctor, if your doctor is not working with you, then it may be time to look for a new doctor. You know, and there's plenty of wonderful doctors out there. Really, there are a ton. And sometimes they're a diamond in the rough. Referrals are a great way to go. Like if you have a personal friend who knows somebody, that's how I found this other doctor I had to go to. And if you have a doctor that you trust that can refer other people, that's always important, okay? So there's 5 actions that support a good doctor-patient relationship. So if you're sitting down and you're saying, hey, I don't know if this is the right doctor for me, here's some of the things to consider, okay? Number 1, your doctor should always provide you with reassurance. Right? When you go into an office visit and there's a concern, it's scary. Okay? I don't care. It doesn't matter if it's as simple as just like a little tiny symptom that really isn't, that is just acute and is quick, versus a chronic illness. It doesn't matter. It's still scary, right? Nobody wants to be ill ever. Okay? It's scary. You don't know what the doctor's going to say, right? So sometimes it requires an exam or lab work to confirm a diagnosis. So it's very important that the doctor reassures you and understands that this is scary. Sometimes simply just saying, I know this is scary. I've got your back. Here's what we're going to do. We'll know, next week when this comes back, when this test comes back, I will be here for you. Don't worry about it. I am 100% on your team. Sometimes just taking 30 seconds for a doctor to say that makes all the difference if they mean it. And I think they do. I do believe that doctors truly want to help people. Some people just don't have great bedside manners, right? But that is very important. That's important to me when I look for a physician, and it's important to me as a physician that the patient understands that I'm there. Sometimes I don't have the answer that day. Sometimes there isn't an answer that day. Sometimes you can't find what's wrong. Going back to Rick, sometimes it's a needle in a haystack, right? And it takes months and months and months to figure out what's going on. But is your doctor on board with you? Are they still looking? Or did they do one test and say, well, not that, so I don't know, you must be fine. Keep looking. Think outside the box, right? We're on a team. That's the important thing. So Rick, to go back to your question, see if your doctor's on the team. If they're continuing to look, that's good. If they've stopped looking, so reassurance is very important. They've also shown that patients who look to their doctors for comfort and guidance and are given that have better compliance. They get well faster, okay? Number 2, and this kind of goes back to what I was talking about with taking time to answer questions. Number 2, your doctor should encourage you to ask questions. This should be something encouraged, right? Do you have any questions? Do you understand how this medication works? How can I make you feel more comfortable with this? What's the hesitation? Talk to me. What's going on? When I mentioned this, you seemed to back away. You weren't sure. You got quiet. Why? Do you have something in your head you want to talk about? These are things that are very important in an office visit. And doctors need to be open to that, right? Now, like I said, sometimes time is of the essence. When my mom was diagnosed with cancer, understandably, we had 1,000 questions. The office visit was literally like 7 minutes. So the doctor didn't have time because he had to run out and save the lives of somebody else, so we had to make appointments to come back and discuss it. But in his defense, he did, so that is very important. There should be an encouragement to ask questions. If you end up leaving your appointment with unanswered questions, you are less likely to be well. Do you guys agree with that? Like, what makes you, as the patient, comply to a treatment plan? You know, is it because the doctor ordered you to do it, or is it because you understand it? You know, for me, I have to understand something before I'll do it. You know, that's how, and I do believe that's how I have such great willpower, right? Why do I stick to a plant-based diet? Because I believe it works. I know how it works, right? If someone just said, hey, you need to eat meat to feel better, I'd be like, to why? Now, if somebody could explain it to me in a way that made sense, you know, then maybe we would. But respect on both parties. Respect for the patient, respect for the doctor. I think a mutual respect is critical in any doctor-patient relationship. Kelly says, I worked in the hospital for 20 years, worked for several doctors, and I can solemnly swear that you are one of the best out there. Oh, you're sweet. Thank you. Thank you, but it's not, for me, like I said, I'm surrounded by very, very intelligent people. I refer to doctors that I consider even smarter than me. Dr. Gages being one of them, going back to that. She's one of the smartest people I've ever met. But that doesn't mean anything if you don't have a relationship. I do appreciate that, but the relationship, I think, is what really makes you feel confident and allows you to grow as a patient. Yeah, but thank you. I appreciate it. All right, number 3, one of my biggest pet peeves. This has to happen. Listen up. The doctor should go over your lab reviews with you and give you a copy of your labs. If you are not getting a copy of your labs, they are not doing you a service. Even if it's over the phone, the nurse says, hey, all your labs are normal, say, great, can I get a copy? Because I'll tell you, I find this more than anything. Someone comes to see me, I go, hey, how's your cholesterol? Oh, I don't know, I think it's fine. I mean, I never was told it wasn't. Okay, well, what is it? Oh, I don't know. Well, didn't you get a copy of your labs? No. Hold on, I lost Instagram. What is it with social media lately? I'm losing people. Anyway, copy of your labs is very important. You need to know what those markers are. Come on, Instagram, come back to me. All right, well, you need to know, this is one of the most important points too, you need to know, what is your cholesterol? What are your blood markers? When you're told the blood is normal, what does that mean? What did they run? A lot of times, there we go, we're back. A lot of times you don't even know what labs the doctor ran. You just got a call saying, oh, all your labs are normal. That doesn't work. You need to know what that means. Well, what's normal? Okay, what were the numbers? Because you know what? One of the most important things is to compare year to year. If your cholesterol is normal now and it was normal last year, but it's increased by 30 points, that might make a difference. Blood sugar, you know, if you're looking at kidney health and, you know, I ask people, well, how is your liver, how are your liver enzymes? I don't know. My doctor said everything was fine, right? Get a copy of your labs. If your doctor is not going over your labs with you and you are not getting a copy, you are not getting the service that you need. You need to understand what your body is doing so that you can get better at it. Rosa just received her lab results on the app but doesn't understand them. I get that. And sometimes they don't have time to go over everything, but the fact that you have a copy helps because at some point, those numbers are going to come into play, okay? And you're going to want to know them, okay? Must keep lab results. Sorry, Instagram, I lost you for a bit there. I tried to pause, okay? So very, very important. You can feel confident that your doctor values a strong doctor-patient relationship if they take the time to review and go over your labs with you, okay? Number 4, I think this goes without saying, but I'm going to mention it anyway. A doctor should be non-judgmental. Sometimes that's hard. I think in this lifetime, you know, we judge a lot of people, but for example, let's just use an example. You know, it comes to supplements. Some doctors are not familiar with supplements. Like, let's say that you see a naturopath, and the naturopath says, well, you should take zinc, vitamin C, and vitamin D. And you go to your regular doctor, and they're like, well, why are you taking vitamin C? And you're like, oh, my naturopath is doing that. Well, yeah, that's stupid. That doesn't work. Do they know? Like, you know, it's not their area. I don't tell them what to do. You know, so if you've done your education and you come prepared as a patient, the doctor should be open to that, whether or not they agree. Sometimes people come to me and they're on certain things, and I don't necessarily agree. But they tell me why they're taking it. They feel confident about it. Who am I to judge? Maybe it does great. right? Okay. So if you're feeling judged when you go to the doctor, probably not a good doctor, right? Lastly, your doctor should know your goals and preferences. A good example of this that's highly controversial, but it's a great example, is people who don't vaccinate, right? If I have someone in front of me that literally does not vaccinate ever, then I know that's their preference. So I'm not going to sit there and recommend it, right? Because it's just we're going to talk about alternatives. How do we improve the immune system? How do we avoid exposure? We're going to find other ways around that, right? If you have certain goals you're trying to reach, it's the doctor's goal to help educate you on how to get there, motivate you to get there, right? So goals and preferences matter. I will say, like I told you earlier, and this is kind of a summary to it, not everybody is a good fit. Not everybody who sees me likes me as a physician. People who want an authoritarian, like do this, and doesn't want to, like get to know each other is not a good fit for me. They're not going to do well with me, right? But the people that want that are going to do great with me. And that's okay. Like, not everybody's everywhere. So you got to figure out what motivates you to be well, what motivates you to improve your lifestyle, what motivates you to try to be healthier than you are, and find a physician that fits in that mold with you. And everybody is completely different, okay? So ultimately, the choice to get well is up to you, the patient, with the right team. So my goal today in talking about the doctor-patient relationship is to help you kind of take assessment of who's on your team. Do you need to find someone else on your team? Is this the right fit for you? How can you hit where you need to go? Because ultimately, the person who makes you well is 100% you with proper guidance. You guys agree? Any of you that prefer the authoritarian model with the white coat behind the desk and 15-minute appointments? Thank you for your comments. There's other physicians that watch me. She's saying that I could educate other physicians and wishes I would. There's a lot of physicians who join in. I see a couple on Instagram, some that I know. And I think there's a lot of really good physicians out there. A lot of really good physicians. I'm not anti-physician. I'm not anti-conventional medicine at all. I'm integrative for sure. But I think everybody has to find the right fit for them. I have people that come on here and say, oh, quit blabbering. You talk too much, blah, blah, blah. Then we're not the right fit. Go find a person that doesn't. That's fine with me. I just want people to be well. So take assessment. The goal today is to take assessment of your doctor-patient relationship. If you feel like you have a good relationship with your doctor, but you're still not growing in your health, take the time to let them know that. Communicate. Set up an appointment to discuss those concerns. Write it down. Send them a letter. Send them an email. A lot of doctors have portals. I know I do, where patients can write and, concerns. Take the time. If you really feel like there's a good rapport there, take the time to let them help you. You have to be open. If you trust the person, I believe as a patient, you become more open to possibilities, right? In my country, most doctors behave as authorities, and those who are willing to talk to you, they're absolutely great. It is so important for patients' confidence to feel that your doctor focuses on solving your problem. I appreciate that. Thank you. So, okay. Any other comments on this before I sign off? Was this valuable to you guys? Kind of a different topic today. As a follow-up, you can find articles such as this about the doctor-patient relationship at drpingel.com. Also, private label supplement line coming out soon, very soon, like really soon. I'm excited because I want to be able to help educate you on what nutrients do so that you can take this to your doctor that you have a good relationship with and have a conversation. That's the goal, right? My doc will not prescribe me. Jack told me once to get off told him to exercise. I think you have to be frank sometimes. I'm very frank. I think most of my patients would agree that I don't really beat around the bush. I'm like, all right, this is the situation. What do you want to do about it? But there's a collaborative, kind of a loving joking in that way too. I'm like, look, I don't have a medication for you to lose weight. You're going to have to start exercising. Oh, okay, doc, I get it. And they know it comes from a place of love. Dear doctor, should an older person have an internal medicine physician as your primary care or GP? You know what? I don't know that the discipline matters. I think it's more so the relationship. Do they understand? Do they explain to you what's going on in your body? Do you feel comfortable with them? Are they willing to have conversations? I think that's really the two tests, whether they're a primary care, whether they're internal medicine, whether they're a DO, an MD, an NMD, whatever. I think it comes down to their relationship and do you jive with them? I think that's really, honestly, when it comes to your main primary care, is a doctor that cares. I mean, I think that's really what I look for more than the distinction. You know, this was valuable to you. Thank you. Thank you. Yes. Oh, this was great today. Great. I appreciate it, guys. See, sometimes these topics that are a little bit different, a little bit more personal, go over, and sometimes they don't. But anyway, hope you guys learned something today. I'm going to head off. I will be here tomorrow at my usual time, 9:15. You want to check out the article on this. It is on drpingel.com. I did write it a while back, so if you search relationship or doctor, it should pop up. So check it out. Has links to some of the studies that we talked about. And for all of you, please be well. And I will see you guys tomorrow. Okay? Bye.